talk about the tilt table test and my personal experience. So I've been struggling since high school. I would have episodes where I would pass out, and it would be about every year, and my symptoms would go away, but they seem to change sometimes. So I've had some experiences where I would start feeling really sick up to the point where I would pass out. And then I've also had times where I'll pass out and then it'll take a week or two for me to start feeling somewhat normal again. So I've had this for several years, and recently, within the past year, my symptoms onset very severely where I was passing out or getting lightheaded. I would get tunnel vision. I'd get a lot of different symptoms, and I thought it would either be vertigo, or I've had doctors tell me and therapists tell me that it's anxiety or depression. The primary doctor I'm seeing, or family doctor I'm seeing, he had me go to a nose, ear, and throat specialist to have all that checked out. I've had MRIs done, I've had x-rays and blood work. I've done tons of blood work. They've tried to set me up with different neurologists. None of them seem to know about POTS, and none of them categorized it as that. They were continuing to do all these testings without giving me any treatment or any idea of what I could be doing for treatments aside from the antidepressants, anti-anxiety medications. They were putting me on vertigo medications, so that they were giving me all of these different drugs without any actual diagnosis or any idea as to what the actual issue was. So if you're going through that, I would be skeptical of just taking whatever they hand out. I would want an actual diagnosis before they start prescribing you anything. The tests and doctor appointments and whatnot have been crazy. I've been having a hard time getting to my appointments because it has limited my driving and my ability to, do normal everyday things. So, it's difficult to prepare to go to these appointments at times. So I've been either having my mom or my aunt or someone else drive for me if I'm able to do that. I wouldn't recommend driving if you're having these symptoms and you don't have a diagnosis or you don't know exactly what is going on, because if you were driving and heaven forbid you did pass out, that would be terrible. So in my experience, it took all of this testing and going through all of this to find a cardiologist. So my primary doctor, he set me up with an appointment to a cardiologist, And from there, he had me do like the NASA tilt test, and they took my blood pressure and whatnot, and they did that. So they do like where I'm laying flat, they'd have me sit up, and they'd have me stand, and then they'd be monitoring where my heart rate was and my blood pressure was. So they had me do that. They had me do a 24/7 heart rate monitor. That was very simple. You just apply a sticker and it just stays on your chest, and you just wear that for a week. They are waterproof, so you can wear it in the shower and whatnot as well. I didn't find that that affected me at all. They did all of that. I think I did actually 2 of the heart rate monitors. The first time they didn't really seem to find anything, but the second time they said there were some abnormalities. They don't really tell you what they are either, so it would be wise to go in and actually look at your test results and review what's on there. And if you have ChatGPT, you can reference that. ChatGPT isn't 100% accurate, but it gives you a good understanding of what's going on, and you can use Google and another search engine to compare as well, and then you can bring that up to your doctor or talk with them or ask questions. So they did that. They also did an EKG that showed an abnormality, and with all of the testing that I had gone through, the cardiologist said that he did want me to do a tilt table test to determine if it was POTS. He said that he didn't believe it was, but he wanted to rule it out. And he was telling me that you will most likely pass out, and he was pretty much trying to scare me before I went to this appointment. And I had been doing tons of research. I've seen where people are fastened to a table and their arms are out to their side and they look like they're getting crucified. So that was a little nerve-wracking, and I've seen where people do pass out and they do have a lot of these issues while they're there. They also have these tests where they'll give you medicine to try and induce you passing out or make your symptoms worse. You do not want to do that. You want to actually see what your body's doing naturally. So I got to my appointment. I had my family drive me there in case I did pass out or something went wrong. I didn't want to have to be driving there, So we got there, we checked in. I was only allowed to go back. No one else was allowed to go back with me. The person that was working there that did my tilt table test was very nice. They have you lay flat on a table and they'll Velcro you onto the table, and then they'll give you a intravenous port, or like a way that they could give you saline. They didn't give me any medicine or anything to induce my symptoms, so they just do that so in case you passed out they can give you saline, and then that would improve your symptoms, when you do finally wake up. They also put a blood pressure cuff on my arm, and then they put on the stickers or electrodes all over to see, I think it was like an EKG and the heart rate monitor as well. So they had me lay flat for a while to see what my baseline was at, and then the table slowly elevates. It's not like it whips up or it slams up. And that's what I've seen some people say as well. It's slow, it's like a reclining chair or something like that. The blood pressure cuff will go off every minute. So by the end of my test, my arm was black and blue. It does, it will probably bruise your arm up because they're doing that for about an hour, I believe. And you have to just stay there at that, like a 45-degree angle, and they just monitor where your symptoms are. It's not as bad as everyone says. From my personal experience, the symptoms that I have, they were worse doing this, but I did not pass out. They do have that, but he had told me it's usually maybe once a week they'll have someone that does pass out, so it's not as common as people try to make it online. I think there's a lot of people trying to, get views or whatever, making it very dramatic, and I'm sure that there are instances where it is, worse. The one patient that he actually had, he said that there was someone that actually did die from doing a tilt test. Medically, they considered that he died, but they were able to resuscitate him. It could happen, but he's like, that's the only one that they've ever seen like that, or at least from what he said. And I was asking him all these questions about what he was doing and what was going on and whatnot. So I mean, he was talkative, and I'm glad that he shared that with me as well. Because most doctors, even if you do like an ultrasound or something, they won't talk with you, which I don't like. I prefer that they give you what they see and just tell you that it's not medical advice, and that you can review it with the doctor as well. Because a lot of these people, they do know what they're talking about, and they do have information to share. I think that's something that is taboo for them to talk about, but it's worth asking them and talking with them. So they did the test, and they did find several abnormalities with my heart rate and my blood pressure and whatever else, and all the other testing. So from that, they were able to diagnose me with POTS or dysautonomia. From there, though, there's different classifications of POTS, like hyper-POTS and several other categories, and dysautonomia is very broad as well. So I'm working on trying to figure that out now, and it's very difficult to get these answers. It's not like everything's in one place, so I went to the cardiologist, and then he got me this test done. And then, like I said, I've been to several neurologists, and the functional medicine, it just seems to keep going. And the specialist that I did see that has a huge wait list, it's like 8 months to get in to see him, he had nothing to offer me. So even though they may be some of the best ones in your area, they may not be able to help you. So you should definitely do your research, and if you can, you might need to actually go to a different hospital or somewhere outside of your state, or, you know, in a different location in your state, the test, you know, it wasn't bad. Like I said, I didn't pass out while I was doing it. They also get a lot of people that will come in and they will believe that they have POTS and it could be something else. So that's why they're doing this, because they'd like to rule out that they want to make sure that that's what you have. And there's also some people I've been seeing that will claim that they have POTS and they really don't. So this is a good way to get that diagnosis if you truly believe that that's what you have, and you know, you can use that for your insurance and whatnot as well, if that's the route that you're gonna go. The holistic doctors, they're all out of pocket, so that makes this very difficult as well. If you're finding, like I have, that the holistic route seems to help your symptoms, you're gonna have to pay for all of that. So you really need to do some research, and like I had mentioned in my other video, there are a lot of people that will try and take advantage of you, and there are a lot of people that don't know what they're talking about, and they will claim that they do. And it's like I said, I mean, the one I was going to, they charged me $700 up front to do all this testing, and it was going to be thousands of dollars to get treatment. And you know, I couldn't even call in to talk with them or get a hold of people, and trying to send them my medical information and whatnot, it was a disaster, because they couldn't even get my information before my appointment. That's something that you should really try and get, is having that information already with them before you make your appointment or you go to your appointment, and that also give them some time to review that. I think that it's important to have both. I think you should have a good family doctor and a good holistic doctor. They are somewhat difficult to find, and I think that they have different roles. So my holistic doctor can't necessarily treat my symptoms, but he's helping me search for someone that can treat my symptoms. And the functional medicine doctors, you're gonna have to go on your own to find them. I haven't found any family doctors or any other doctors that will recommend a holistic route or functional medicine. I found that the same with chiropractors. When I was trying to do physical therapy in the beginning of this, they condemned going to a chiropractor, but I've found that they help tremendously as well. And I mean, it's one of those things, it's like, you know, they can tell you how horrible they are, but you know, it's like with a chiropractor, there were days where I couldn't move or walk or do anything, and I would go get adjusted and I would immediately feel better. And that's the same with the doctors for this, the holistic doctors. I think that they definitely have a place, and I think it's definitely worth looking into. Just don't go to someone that's going to try and rip you off. And another thing that I found is it's not even necessarily the appointments. So like I said, they charged me $700 up front, and then they were going to charge me thousands for my future appointments, but they're also going to try and charge you for supplements and a lot of these other items that they'll recommend. So you really got to be conscious of what they're gonna do before you start seeing someone like that. And you can make phone calls, you know, call them and ask them what they can provide, and if they accept a FSA or HSA account, because most of them will actually accept that. You can't necessarily use your insurance, but that is a good way to help with some of these bills. Anyways, I think I'm gonna cut it there. I hope this can help someone. Take care. I forgot to add a few things. So, before your test, you're not allowed to eat or drink anything, and the test will stop if you pass out. They're not just going to keep you elevated like that. They'll lower the table back down, and then they would make sure that you're good. And like I said, they would give you saline. The end of the test, it's the same thing. They just lower the table back down. It's not fast. They're not raising the table up quick and lowering it quick or anything crazy like that. The reason that you should get a holistic doctor and a family doctor and vet them or do your research on them and not just take what someone says online or what your doctor, you know, just pick one doctor and take their word, is because your symptoms may be extremely different than mine, or they might not have the right information that you specifically need, or they may not know anything about this. My family doctor, he was saying recently there's been more people getting POTS and dysautonomia, all these symptoms, so it's becoming more and more common, and it's still not very well known. So I would highly recommend that you do some research and find a good family doctor and a good holistic doctor. Another thing that I would add to that is like my cardiologist. So he did all this testing and physically everything is okay. My heart's normal, and you know, they can't go in and do surgery or something like that to fix this. I mean, I guess some people are getting pacemakers put in, and I don't know that that's the answer to this, and that's what he was telling me personally. He doesn't have any solutions or any treatment that he could give me. So aside from him getting me this tilt test done, that was all he could do for me at this time. It's not my heart, it's my nervous system, from my understanding, that's out of whack. Another thing that I didn't add, I mentioned the saline, getting an infusion of saline. The one that I personally get, it's called a Myers cocktail, and then I have them add glutathione to it. And I do find that helps slightly. And like I said, like in the summertime where it's extremely hot, and if you know that you're getting behind, or if you're extremely sick and you're not able to drink enough water, I would go and get one of these, as long as you do research and you know you get like advice from your doctor or whatever it is you need to do. The one that's local to me, I don't need a doctor prescription to go in and get one of these, but they are expensive. They're like anywhere from $100 to $200, I believe. So that'll add up really quick as well. There's been a huge shortage for a long time, like over a year, because there were some factories, I guess, that were producing in America, and I couldn't medically get infusions or saline. You may be able to do that through your family doctor, and that would be much cheaper as well, but it'd just be the saline. You're not going to get the vitamins and whatever else that's in the Myers cocktail. Unless they're able to do that, that's something that you would have to look into. I think that was everything, but like I said, I hope it helps. Take care.